Did you know that bioidentical hormones are 40% more effective at preventing heart disease than a statin is?
Welcome to Wellness, your ultimate guide to unlocking your full human potential through biohacking. I'm your host, Ashley Deely. I'm a certified sports nutrition coach, former personal trainer, and Pilates instructor, and I have a degree in kinesiology. My goal is to help you improve and elevate the quality of your life. When you leave a review, it makes a positive difference. Whether you're listening on Spotify, watching on YouTube, or listening on any other streaming app, it helps listeners just like you find this hidden health information faster. If you're using Bluetooth headphones, it's seriously time to upgrade your health. Bluetooth headphones are constantly emitting EMFs, and the International Agency for Research on Cancer has classified them as a Group 2B carcinogen, which means they can cause headaches, fatigue, ringing in the ears, tinnitus, and even fertility issues. Thankfully, there's a lot of ways to reduce your exposure. The first one is to stop using Bluetooth headphones and start taking more calls on speakerphone or using wired devices. And it's not just a simple upgrade as using wired headphones, but rather anti-radiation headphones that literally stop the radiation from traveling from your device directly into your head. The headphones I use are unlike any regular headphones because they use a hollow air tube between the speaker and the earbud. And this design creates a safe distance between your device and your headphone, therefore reducing EMF exposure. These headphones also work with any adapter, and they have a handy little microphone as well as a pause and play button for you to take calls and listen to music or podcasts. To find out which headphones I'm talking about, visit ashleydeely.com/headphones. America hasn't updated its beauty laws in over 80 years, and the cosmetics industry is highly unregulated, meaning harmful chemicals are hiding in your typical drugstore and big box products. But ARAZA Beauty is the first paleo-certified makeup line in the US, made with real ingredients you can pronounce. No parabens, phthalates, hidden toxins like PUFAs, titanium dioxides, or silicone fillers. Their formulas are nourishing and actually good for your skin. Visit arazabeauty.com/Ashley Deely, ARAZA. That's arazabeauty.com/Ashley Deely. Today's guest is one of my favorite MDs on the planet, Dr. Tom Rogers. He's actually a returning guest, so if you missed episode number 71, I highly suggest you go back and check it out. Dr. Tom Rogers is the CEO and medical director of Performance Medicine and a nationally recognized expert in family, sports, and integrative medicine. With over 3 decades of experience as a family practitioner, Dr. Rogers has dedicated his career to providing personalized, patient-centered care. For the past 18 years, he's built his private practice with a vision to work for the patient, not the insurance company. Dr. Rogers brings a unique holistic approach to health, focusing on root causes rather than symptoms. His mission is to help patients achieve optimal health through lifestyle medicine, bioidentical hormones, and evidence-based integrative therapies. Beyond the clinic, Dr. Rogers is the host of the Common Sense MD podcast, where he simplifies complex health topics and empowers listeners with practical tools. His goal is to make patients feel like they're talking to a knowledgeable friend who cares. He combines the best of allopathic and alternative medicine in one. Dr. Rogers, welcome to the show.
Thank you, Ashley. I appreciate you inviting me again.
Oh my gosh, well, you were just one of my favorite conversations, and I wanted listeners to know that this is going to be released on Friday, the 26th. My birthday is the 29th, so I thought, what a special occasion to have Dr. Rogers back on the show.
Happy birthday. You know, you don't turn 30. That 30 is a milestone birthday. Congratulations.
Well, thank you. I'll take 30. Yes, we'll stick with that. Last time you were on the show, I feel like we just touched the tip of the iceberg with low-dose naltrexone. So
Okay.
I want to get right into it today and ask what you can use it for.
A lot of things. It's a broad spectrum drug. It's actually a prescription drug, but you can only get it through compounding pharmacies at the time. But of course, it stands for low-dose naltrexone. And people think of naltrexone as a drug we use for opiate addicts and sometimes alcoholics, because we do use those drugs in high doses, 50, 100 milligrams to really take cravings and pleasure away from people that are opiate addicts, and also works pretty well for alcoholics too. But it kind of has the opposite effect when you use it in real low doses. Remember, with medications, the dose is the magic. And you can sometimes overdo it, and you can sometimes underdo it. Drugs have completely different mechanisms at different doses. That's one good lesson for doctors to learn. But in any event, so at low doses, generally we start out at a 1 milligram, and in a week we usually go to 3 milligram. If it's helping in a month, we'll go to 4.5, which is the usual dose. Sometimes we go higher, but really the way it works is it tricks your brain into releasing its own endorphins. So we use it to kind of cool off inflammation, especially with autoimmune diseases. That is my favorite place to use it. I mean, if anybody comes into my office with Hashimoto's, um, rheumatoid arthritis, lupus, MS, I put them on LDN because it's got a really low side effect profile. It's very, very safe. You don't want to take it if you're, say, you're getting surgery and maybe on an opiate post surgical, but just because it wouldn't interact with it, but it may kind of take away from some of the pain relief because it blocks it down a little bit. But in any event, so examples of, matter of fact, I saw a very interesting patient yesterday that I put on it. This was a pulmonary physician that came to see me for the first time, and she had Hashimoto's. Her TPO antibodies were out the roof. She also was testing positive for lupus, a very high titer of her ANA, and was coming to me for help. And it's really interesting in her case because she's very open minded, and she got on a carnivore diet for severe osteoarthritis that she'd had since she was a teenager. And she doesn't have any pain at all being on
Wow.
a carnivore diet, which is probably my favorite diet. I don't know how you think about it, but
Yeah.
it certainly, in a lot of cases, is a healing diet. You have to know what you're doing. But in any event, so she knew nothing about LDN. So, of course, I put her on LDN. A couple months, I'll recheck all her labs, inflammatory markers, and they'll be down, and uh, she'll like it. So I do use a lot of it. Also, of course, we used a lot of it during COVID, and we use it especially for
Mm.
what we call long COVID. And this is a medicine we've been using for years and years and years in the functional medicine world. And nowadays, people are starting to learn about it because, for example, we have all this long COVID. Everybody treats, nobody knows how to treat it. If you went to the Stanford long haul COVID clinic right now, the first thing they would put you on is LDN, which is,
Oh.
I'm very happy about that because it's going to be more accepted in mainstream medicine. But as you know, doctors have this thing called cognitive dissonance, so it takes a long time to use something kind of outside the box. So, that's what we did with treating COVID. And now we're doing it for a lot of post COVID changes because, as you know, it set off a lot of autoimmune diseases.
I like that the patient you're seeing, who's also a physician, is open minded enough to come see you.
I treat a lot of doctors. Mainstream medicine's in a tough place right now, especially with primary care.
Mm.
We can do all these great things in surgery and, with new cancer treatments, we can operate on a fetus with a heart valve. I mean, it's incredible the technology that's
Wow.
out there. Yet our country is, what does it rank? 34th in the mortality rate of industrialized countries. I mean, we are in a bad shape, and it's getting worse, in my opinion. And it's a lot of it's because of they don't get down to the basics trying to solve the problem. I could go on and on for that, but
Well, that's why I'm thankful for your work. So it sounds like LDN has a lot of off label uses. If you were, say, a biohacker, why would you want to use LDN?
well, you're trying to get at the root cause of the problem, which is really, what biohackers do. And a lot of times mainstream doctors, which I would describe myself as a blend between traditional and functional. I'm board certified in both areas, so I know the best of both. You don't need to get so far out where you ignore the good stuff on allopathic medicine, or the other extreme where you won't take a life-saving medicine when you need it. So in answer to your question, um, most doctors treat symptoms. We're really trying to cool off inflammation in your body and get to the root cause of the problem, which is a lot of times gut health. I mean, most of your immune system is in your gut. So that's the first thing I ask people. When I see an autoimmune patient, or a patient that comes to me who's been everywhere else. I mean, I had a lady yesterday that had been to the Mayo Clinic, had no answers whatsoever,
Oh,
which is world famous clinic. Um, no answers for her. And so with her, we need to try things outside the box. A lot of traditional doctors are so rigid that they're not willing to do that when they know it's completely safer. They're just probably not educated on it. It's not really their fault. I tell my patients that often. Do not blame those folks at the Mayo, because they're very traditional. They're very academic. They're smart. But if there's not a double-blind placebo-run trial on this substance, and it's not FDA approved for that use, then they won't use it. So it's sad. So fortunately, there's some biohackers out there.
since we're on the topic of gut health, walk me through some of your modalities that you would help treat someone to get to the root cause if they are having issues.
Well, the first thing you do is ask them questions. As a physician, you have to learn to listen to your patients. If you find yourself as a doctor talking most of the time, you're not listening. So, and you have to know how to listen, because you get these subtle clues as to what may be going on, because there's so many factors in a person's well-being, including emotional health. That gut brain connection, your vagal nerve. We look at a lot of vagal nerve tones and things like that. Um, so I just ask them a bunch of questions, and 99% of the time, when they come into me with an inflammatory condition like an autoimmune disease, the first thing I say is, after we get to know each other, and I'll say, "How's your gut?" And 99% of the time, it's terrible. My gut is terrible. I have bloating. I have constipation. I have food sensitivities. So the first thing you do is quiz them down about what they're eating. And, they're eating a lot of inflammatory foods like sugar, glutens, dairy, nightshades, corn, soy. You start kind of filling that out a little bit. And then, you look at stool samples. Sometimes I run a lot of GI maps. A lot of people have candida. A lot of people have SIBO. Um, A lot of people have H. pylori, and a lot of people just have delayed food sensitivities. We use an ALCAT test or a Dunwoody food sensitivity test that, a lot of times. And we try to guide people on the appropriate choice of probiotics, prebiotics, digestive enzymes, things like that. And, usually if you can improve the gut, you've won the case. And things will really calm down. But the thing I was talking to you about, stress, a lot of times with autoimmune disease in particular, I see way more women with autoimmune disease than men. Women are smarter than men. They live longer. Men die of the top 10 causes of death. Men die 9 out of the 10 more frequently than women do. 9 out of 10 men die of more often than women. There's 1 out of 10 that women die more often of, and that's dementia, Alzheimer's dementia. But women also, despite the fact that they live longer, after menopause, they get unhealthier. They're really not as healthy as men. They have way more autoimmune diseases, being a woman. And a lot of that comes from hormonal shifts. Women are stronger than men. They're more resilient, but they are prone to these autoimmune issues especially, and I think a lot of them start in the gut. I mean, so many women are constipated that have gut problems, and I think a lot of it stems really from stress and
Mhm.
emotion and trauma, past trauma. I can tell you many stories that I've teased out, um, that women have had terrible autoimmune diseases, and there's always a trigger. I mean, we're all like a loaded gun walking around. The environment pulls the trigger, whether that's a stressful event, food that you eat, terrible sleep habits, hormonal shifts. But if you can get to the base, a lot of times it's childhood trauma that precipitates it. So if you go back, and I've learned that what goes in early goes in deep, and a lot of times it requires a lot of counseling from somebody besides me. Sometimes I
Oh,
can tease it out of them, and I generally spend about 45 minutes, maybe an hour with some of my patients like this, most of my patients. So I have the time, more so than most family doctors have 7 minutes to spend with a patient. And then
yeah,
they're searching for a code to get insurance reimbursement.
that's
That's
right.
why I do a cash based clinic. Um, I'm a way better doctor because of that decision 18 years ago. So there's a lot of emotional things. There's a lot of gut health. There's a lot of things you can look into. So I try to take one thing at a time, one or two, because if a patient or a doctor gets overwhelmed, especially on that first visit, then it's tough. So you have to make some priorities, and the gut is one of my first ones.
That was part of my intro to you in the beginning, that you have the best of allopathic and alternative medicine in one. So you have this really good, robust, comprehensive view of how to treat the patient. And speaking of Alzheimer's and women living longer and being more stressed, it's probably a really good segue to talk about bioidentical hormone replacement therapy. When would you start someone on BHRT?
Well, you start looking at their hormones about right when you're 40. Right when you're 40, you should get a baseline female hormone panel and follow it yearly, sooner if you have any symptoms, because there's a wide range of um, ages that women go through menopause. And typically they go through this peri or premenopausal phase way before they actually stop periods and start having hot flashes. So, of course, it's best to start early and looking at it, because here's the thing I tell my patients: men are simple creatures. We have, when you're talking about the sex hormones, we have testosterone, which just slowly declines over time. Women have four hormones that they need to worry about: estrogens, in which there's three different main types. You have progesterone. You have testosterone that women need, just like men, just a way lower dose. Then you have DHEA, which is an adrenal hormone that's a precursor to testosterone and your other hormones. So, and the thing about females, they cycle. So these, at different times of the month, these levels are going to look different. So you have to know when, if they're cycling 28 days, you have to know when to check for them. Women are more complex. Their hormones, they have more hormones to worry about. They change and they don't drop off at the same rate. In other words, the first one that really drops off is progesterone, and then testosterone. DHEA about the same rate as testosterone. The last thing to go is estrogen. By that time, you're 50, 51, 52 years old, and boom, you are miserable. But actually, when your hormones have been in decline for years. So, and you get estrogen dominant, because remember, estrogen and progesterone counterbalance each other. So when you lose your estrogen, when you lose your progesterone, which is the first one you lose, your estrogen levels go higher. So you get too much estrogen. Most of these women in their mid 40s to 50 are over estrogenized. And that's when you see fibroid uteruses. That's when you have abnormal thickening and weird bleeding patterns. That's when you get fibrocystic breast. So you need to start giving bioidentical progesterone to counterbalance that. And there's some other things we do as well that are supplements like DIM, cruciferous vegetables, things like that. But so, but it's very important, and it's really coming. It's really finally coming out that these hormones are safe. There's a whole generation of women that have been denied hormone because of the fear of breast cancer. And it's all based on this bogus study back in 2003 called the Women's Health Initiative. It was really a cardiovascular study. It wasn't even a hormone study, but it was a huge study, and they looked at a lot of different things. And the result of that study that came out and scared both doctors and patients off hormones because they said hormones cause breast cancer. So immediately, doctors don't want to do it. They're afraid of getting sued. Most of them practice out of fear. So when you really, really break it down, it's becoming well known now that that was a terrible study. And I'll give you the stats on it, actually. So when they did that study, which again was not a hormone study, and the hormones they used were Premarin and Prempro, which at that time were the two most highly prescribed medicines in the United States, top two. So, and now it's like Lipitor, which is an awful drug as well. But in any event, so they studied Premarin and Prempro. Now remember, Premarin comes from pregnant horse urine. So it's definitely not natural to a woman's body. But here's the actual what happened during the study. If a woman doesn't have a uterus, she doesn't have to have progesterone. She still should take it, but you don't have to do it. So you don't have to protect your uterine lining from too much estrogen. You don't have a uterus, so technically don't need it. But in any event, and the important thing about this story was they were using medroxyprogesterone. They weren't using micronized progesterone, which is what we use. It's a bioidentical hormone. It's very safe. Matter of fact, it's the only hormone that I use orally, besides DHEA. So I don't use oral estrogens or testosterone. But in any event, so what happened when they did the Premarin only study in women that had hysterectomies that didn't have a uterus? They did an arm of this where they just used Premarin, a pregnant horse urine estrogen. And the results of that was there was less cancer in the women that used Premarin than the women that used nothing. So that estrogen, even though it's a horse estrogen, actually protected them against breast cancer. There was less breast cancer. Now, in the arm of the study that they did Prem-Pro, because most women have uteruses, in that arm of the study, the incidence of breast cancer went from 4 women per 1,000 on nothing to 5 women per 1,000 on Prempro. So 1 more per 1,000 got breast cancer that was on Prempro using pregnant horse urine estrogen and medroxyprogesterone, which we never use. So it was really fallacy. So it turned everybody off of women's hormones, and it denied a whole generation of women from receiving the protection they need for their, not only to feel better and alleviate these hot flashes, night sweats, miserable, but it also protects your heart. It protects your brain against dementia. I mean, why do you think women don't have heart attacks before age 50 like men do? They've got estrogen protecting their heart. Why do they get osteoporosis 4 times as often as men, probably more than that, because they have protective estrogen? Why do they get dementia 4 times what men do? Because estrogen protects them. It also makes them feel better by far. So it's not just for symptoms, it's for a lifetime. But anyway, it was really great to see. So not only a whole generation of women didn't get to know about this and receive the benefits, and now you look at them and they're brittle. I mean, I can tell a patient that's on hormones at 60 that one that hadn't taken them. They get more wrinkled. I mean, hair, skin loves estrogen. So anyway, not only did you have a whole generation of women that were denied these hormones, you had a whole generation of doctors that know nothing about them. They don't teach it. So where are they going to go get them? And now that they're finding out, hey, these things are safe, they're protective, you have to find somebody like me, which is rare. Because doctors, like I said, have that cognitive dissonance. It was great to see Dr. Marty Makary on one of the morning shows the other day. Did you happen to see that?
No.
He is one of the most published, well-known surgeons, John Hopkins surgery professor, epidemiologist. He's one of the most published doctors in the world. He's also on the new administration, so he's helping about bring some changes to the FDA. He
Oh.
runs it now. So anyway, he got on one of the women's morning shows a couple weeks ago, and he was talking about bioidentical hormones. And he was saying, like I was saying, there's a whole generation of women that have been denied these life-saving hormones, and a whole generation of doctors that know nothing about them. He gives an example. He goes, "Did you know that bioidentical hormones are 40% more effective at preventing heart disease than a statin is?" I certainly believe that. But so it was a great thing to have a guy of that held in that high esteem to come on there and say that. So I think there's going to be a new movement for women that are going to get bioidentical hormone replacement. I mean, I
I
treat
love
thousands.
that. Oh my goodness, that makes my heart so happy. And that's one of the reasons that I'm on hormones. When I learned about them, I didn't realize I was going through perimenopause. I felt like I was going crazy and my sleep was erratic and I was always the best sleeper. But just a few months after turning 37, I had all these symptoms and then I finally heard the word perimenopause.
Maybe that's one reason you look so great. But
Oh, thank you.
in every way, you'll be better. You know,
Yes, I feel better. And also, I feel like a big role that testosterone plays in my life is with the sleep and the energy. And even this morning for my workout, I was doing shoulder presses with the Olympic bar. And, I don't want to be doing shoulder presses with 10-pound weights.
no, no. I mean, I always say I do a lot of longevity medicine. I study longevity, obviously. I always use the term that muscle is the currency of aging. Muscle equals bone. If you don't have muscle, you're going to get osteoporotic. If you don't have muscle, your brain's not going to work as good. It's not just about, showing off at the gym or pressing more. It's about your health. Look at people that have muscle, they're healthy. People that are frail are not healthy.
That's a good
It's the
point.
currency of aging. And I do everything I can to help my patients get muscle on them. I use a lot of creatine in them, HMB, hydroxymethylbutyrate. I have a little combination that I use. So I think almost every adult should be on creatine. It does not hurt your kidneys. Does it cause a little water weight gain? Yes, but the water, it's hydrating your muscles. That water is going to your muscles, and your muscles work better when they're hydrated. So that's the way to think about it. So all adults, with very few exceptions, should be on creatine.
Creatine. And what was the other one you said, Dr. Rogers?
HMB, hydroxymethylbutyrate. It's another muscle builder, fat burner. It's actually a ketone body.
Oh,
That's just another little biohack. There's a lot of them. It's also my firm belief that most adults don't get enough protein. It's very hard to get the protein that you need.
what are some tips that you have to get more protein in our diets?
Eat more meat. Of course, I have a carnivore bent to me. And again, I have a brother he's a vegan. He runs marathons. So everybody has their own preferences, but certainly, I think as far as nutrition goes, uh, and again, any way you eat, you're going to need supplements. I'm a big believer in supplements. People, doctors don't know about supplements. They don't have anybody teaching them about these supplements that we take, and methylation issues and things like that. What forms of vitamins you need. So um, it's a whole new world. People are finally starting to wake up and listen to people that want to stay healthy. For example, a vegan needs, if you're vegetarian, you need the B vitamins. I've put my brother, who's a vegan, he's running marathons, so he's not doesn't have a lot of muscle on him. I think it's more of a mental thing, that the reason he's doing that is certainly not for health. That's for sure.
Okay.
Um, so I prefer a mix of high intensity training with some cardio. Um, I think you could overdo anything, especially as you get older. You need to rest. You need to get that, you know, growth hormone of your own working to what little extent it may work in a 70-year-old.
Speaking of growth hormone, I was really curious to ask you if you practice peptide therapy in your
Oh
clinic.
yeah, of course. Of
Okay.
course. And that's one way I take peptides. And that's one way to boost your growth hormone level is by taking the peptides like cimarelin, or really my favorite one is CJC 1295 with ipamorelin. And I also like BPC 157. Um,
Tell me the CJ one again and what you would use that for.
CJC 1295 with
Okay.
ipamorelin. It is a growth hormone agonist. So it spurs, it's a growth hormone releasing peptide, is what it is. So it just kind of allows your own body to produce more of its own. Um, so, because there's always that question, if you're taking growth hormone, for example, you'll suppress your own production of it. Plus, growth hormone, which is illegal, we can't prescribe it anymore. We used to be able to, but it can be fraught with some danger. So you got to be real careful with growth hormone itself. But it's an absolute great hormone in a lot of ways. But there's also a lot of potential side effects. So um, you don't want to suppress your own pituitary by getting that unless you or absolutely have a major problem like panhypopituitarism,
Ooh.
which can happen, but rare. But so you have to be smart about hormone use, and you have to know about the use of all of them, including peptides. BPC 157 is another great hormone that is called body protection complex. And it's really the only oral peptide that I take. The rest of them are injections, sub-Q injections.
Oh, I also
Uh,
take BPC 157 intranasally.
yeah, you can do that. You can do that. It's great for gut health too. I use it a lot on leaky gut.
So if you start using BPC 157, do you have to take it continually or what does your protocol look like?
You take breaks. You should take breaks from it. Really, should take breaks from most anything, um, especially at certain ages. Um, so my protocol really is just something that I came up with by myself. There's no set rules for this because, again, there's not a lot of double blind testing on it. And, it's kind of the Wild West as far as it goes with peptides. And unfortunately, the FDA does not like peptides. And you know why they don't like them?
Because they can't monetize them.
Right, because there's no money in it for them. Plus, but also because they work. They don't like anything that works. That's outside of their control. Is my theory on it. Kind of like what they did with ivermectin, which was a great medicine that worked for COVID. They labeled it as a horse medicine when it's a human medicine. Yeah, I do use it for a lot of gut problems. BPC 157, but the injectable more for injury type things.
Oh,
You
okay.
can actually use the injectable around subcutaneously around an injury, say like tennis elbow or tendonitis. You inject it sub-Q near the area of the injury every day for a month, and it just speeds up healing. It's
Great.
quite dramatic in some cases, but they're hard to get. I mean, they're hard to get. You got to go somewhere and get them for research purposes only. That's how they're labeled.
Correct. Yes,
And then so
correct.
you're
Never
kind of
for
sitting,
human use.
yeah, and you're sitting there guessing, how do I mix this, which is very important because it's fragile. How do I dose it? So you really got to do your research on it.
That's right. Speaking of longevity, I would be very curious to learn for someone reaching a milestone, what kind of lab tests would you recommend?
Oh, um, probably the best lab test that I draw in my office is a Cleveland heart panel, and I'll tell you what's in it. I kind of pick my own tests that I want for it, and I use Quest Labs for the Cleveland heart panel. And what it does is measures different inflammatory markers to see how inflamed your body is, especially your vasculature. Remember, you're only as old as your arteries are, and that's what kills most of us is arterial atherosclerotic disease, heart disease, stroke. So it gives me inflammatory markers. It gives me a complete breakdown of your lipid particle size, ApoB, LP little a, if your LDL is oxidized, size of your LDL, size of your HDL. So it's a really advanced lipid panel. I saw a lady yesterday. Her total cholesterol was 295, and of course her doctors, you're crazy if you don't take a statin, you're going to die of heart attack. And yet she had no risk factors. She had a 0 on a CT calcium scoring, and her HDL was 95 with huge particles. She had a type A LDL pattern, meaning her liver knows how to get rid of the LDL, the bad cholesterol. And the LP little a was low, which is a totally genetic type marker for bad LDL particles. And the ApoB was moderate. It wasn't that high. So there's no way I'd put her on a statin. The side effects of a statin can be bad. Most people, over half the people that are prescribed them, don't take them because of a side effect. Muscle aches, liver damage, worsening of your diabetes, probably worsening of your brain function. And really, when you look at a statin, if you take a statin your whole life, it's been estimated that it may add 4 days to your lifespan, and maybe a lot of misery too. I'm not saying I don't ever use them. Sometimes I do. Like if you have a stent and bad heart disease, I may put you on a really low dose rosuvastatin, low dose, and follow it. But another statistic, since I'm throwing them out, is say you took 1,000 people with known coronary artery disease, known heart disease, clogging the artery, atherosclerosis. You took 1,000 of those people you knew had it. You give them all a statin. It may save 1 out of 1,000 from having a non-fatal heart attack and add 4 days to your life. I mean, would you take a statin personally?
No, Dr. Rogers. No.
I don't think you would either.
There's a book I think it's called Statin Free World. Dr. Asim Malhotra talks about the dangers of statins and how they're really overprescribed.
They are. You know why they're overprescribed? Here's a dirty little secret, because I used to work in a big group, that was governed by insurance and people, non-medical people that try to tell you what to do. Anyway, so they look, these insurance companies look at who pays doctors. I mean, doctors actually work for insurance companies more than they do for patients. That's a sad fact, and most doctors wouldn't tell you that because they're trying to be good doctors, but they work in a system that's totally corrupt. In any event, if you don't use a statin in patients that have a cholesterol over 200, you get penalized. You don't get bonuses, and you get dinged, and they throw you into a lower payment rung. So, of course, doctors are going to try to get you on a statin to make themselves look better. Oh, I'm treating this patient for heart disease. Look what I'm doing. I'm saving their life. When actually, you're not. You're just putting them on another medicine that has harmful effects. So that's a dirty little secret. Doctors get paid. They don't shell out money to you. Oh, here's, you use Lipitor. Here's your $10. It's very discreet. It's called pay for performance, and which has been a terrible method of payment for doctors. It just leads to cookbook medicine. Throw a patient on every drug you have for their diabetes, for their hypertension, for their hypercholesterolemia, and never ask the patient, what are you eating? What can we do about your obesity? Because that's a real epidemic in this country, is obesity. In fact, it's why I created performance medicine, to treat obese people. And then when I did the fellowship in functional medicine, it led into all this other stuff with knowledge about hormones and all that. But my original purpose was to talk about or treat people for obesity and have the time because so many people are insulin resistant and diabetic. When my 2 children came down with type 1 diabetes, I quickly realized I knew nothing about nutrition. And we had a 1-hour course in it in medical school. And what they taught was completely wrong. I wish we hadn't even had that course. They taught us you need a low-fat diet when that's the worst thing you can do. So it's a different world.
Oh my gosh, Dr. Rogers, I was at a social event a few weekends ago, and I met this woman who had a PhD in nutrition. And I was so excited to speak with her. My eyes lit up, and I was like, oh my gosh, this is the girl I could spend all night talking to. So I said, what do you think about oxalates? And she goes, what? And I said, oxalates. She goes, I haven't heard that word. So then I said, well, what do you think about lectins? And she's like, she goes, I'm not a biochemist. I'm a nutritionist.
That is pitiful. That's par for the course. I guarantee you she doesn't know about oxalates or lectins. I mean, I did a podcast on both those. I did one on oxalates, but because a lot of nutritious foods are packed with oxalates. And if you can't metabolize those oxalates, you're going to get kidney stones, heart disease. I mean, it's going to make your life miserable. Same thing with lectins, that plant protein that doesn't want to be eaten by animals. So we block it down with chitosan. We use that in one of our digestive formulas. It blocks it down. Also blocks glutens down. So there's a lot of little biohacks you can do for that. But yeah, that's sad. I had a patient recently who was in the hospital for an elective procedure, and diabetic patient, and they came to see me the day or two after they got out of the hospital. And I go, well, how'd it go? Fine. My sugars really ran high. I go, well, they knew you were a type 2 diabetic, right? Yeah, the dietitian came and talked to me twice, I go, okay, what, you got out of the hospital yesterday morning, right? Did they serve you breakfast at the hospital? She goes, yeah. I go, what was it? She goes, 1 egg, 2 pieces of toast and jelly, and orange juice for a diabetic. So they're totally misinformed. I've only met one nutritionist that I've ever trusted to talk to my patients. One. That's the guy I have working with us one day a week. He's amazing. And he knows all about this stuff. Peptides, he knows about not only nutrition and oxalates and glutens, but he also knows about a carnivore diet, the ins and outs of it. He knows about what supplements you might need if you're on a particular diet. But so yeah, it's a crazy thing. The nutritionists have a lot of cognitive dissonance going on, just like doctors do. These people are so misinformed.
So what kind of actionable takeaways do you have if we want to clean up our diet?
Listen to your gut. I would start over again. If people's guts are messed up, if you're humming along, you're fit and you have normal bowel movements, no bloating, gas, heartburn, nothing. Another thing we do is get people off PPIs, proton pump inhibitors, like a meprazole, which people put you on for a little heartburn. You're on it the rest of your life, which is very deleterious to your whole body. So figure out whether you have too much acid or not enough acid. A lot of times, over half the time, it's not enough. So you use something like betaine, and check and see, do a betaine challenge test. But so start with symptoms, and I start people over again. I just say, look, cut out. I like Carnivore. If you're really having a lot of problems, go Carney. Read Dr. Salandino's books, Carnivore Code, or go Carney, and then start adding some maybe certain fruits in there. Don't eat raw vegetables if you can help it, because they don't digest very well. But so I just a diet that's very basic that I believe in, and then you can add things to it. So you don't have to do a GI map on everybody, because sometimes to be honest with you, it's almost overkill with some of these tests that you can do. And on the other side, I do have patients that I call they're overkilling it. They're so obsessed about every little thing. They get so many tests that it just leads to a lot of confusion. I tell them, I live in the South, so I say, look, you're overcooking your grits. Let's start out with some basic common sense things that you can do. And everybody's a little different with their guts. Everybody has different tolerances, different sensitivities, and some of it may come from, what you ate as a kid, what your mom ate when she was pregnant with you. I mean, it goes all the way back to that, the gut microbiome of your mom. And that's why I really like vaginal births, not C-sections. I can't believe all these women are getting these scheduled C-sections.
All of them. They're all scheduled.
What is that?
I don't know.
I hope they're swabbing them down with a little bit of the vaginal mucosa after they do that, because they need that.
You know what's funny is one of my dear friends was getting ready to give birth, and I said, I know that I'm the healthiest person, and if there's anything you ever listen to me on, if you have to have a C-section, I would love for you to go down there, just grab some of the mucus that will come out of your vagina and just put it over your baby's face when he or she is born, so they can absorb your microbiome. Right.
That's exactly right. It's so helpful. We live in a sterile environment. There's a good book called Eat Dirt, and it's pretty good. We're too sterile. We need to play in the dirt.
Little dirt don't hurt.
I like that. That sounds like a Southern person would say. You're a New Yorker. That sounds like somebody down south would say that phrase.
I mean, I'd like to consider myself pretty polite. One of my friends is from the South, so maybe I have some of that Southern charm.
I think you do.
When I get my mushrooms from the farmer's market, I don't wash them. I just eat some of that dirt.
Good. That's right. If you trust, your farmer, you should. We get all our beef and chicken grass-fed, grass-finished, no pesticides, no hormones. It's the greatest beef you'll ever taste. I have patients order it from where I order it. I don't make money off of it. And I have freezers in each one of my offices that they drop off. They just order it and pay the Brookside farms, and then they just pick it up for convenience at my office, because I have 6 different offices that are spaced out around the East Tennessee area. So it's just convenient. Their eggs are great, so I even get raw milk for myself.
Dr. Rogers, someone could come arrest you if you say that.
Well, I use it for experimental purposes for my pet.
Oh, okay.
I use it for my pet.
Okay. Whew. Okay, then we're in the same boat. I do as well.
You give your pet raw milk too?
Yes. Good. Yes, my pet rock.
That's funny. I love that. You could get into so much crazy stuff with that, but because I ordered some raw chocolate milk, which is amazing. Oh. And somebody asked me, I go, yeah, my pet loves chocolate milk. They go, dogs shouldn't eat chocolate. It's a crazy.
Oh, it's so funny. I was on social media a few weeks ago. Something really surprising caught my eye, and it talked about how raw milk put hundreds of thousands of people in the ground every year. So many hundreds of thousands of people died from raw milk. And then the next part of the video said, just kidding, that's diabetes.
Oh, that's a great one. I have got to use that one. It's crazy because I'm very lactose intolerant. I mean, if I drank milk or drank a milkshake, I'd feel terrible for 2 days. But raw milk, no problem. And again, it's coming from A2 cattle that you get all the milk and the beef and all that stuff from. So it's
Why
good.
do you think you don't get sick on raw milk?
Because it hasn't been homogenized and, taken all the nutrients out of it. That's the reason. There's no doubt. Well, I also take colostrum. Do you use colostrum as a supplement?
I do. Yes, I do.
Yeah. If somebody's gut's messed up from COVID or anything, use colostrum.
Is it Armra? That's the one
Armra.
I use.
Yeah, that's Armra. I think it's a pretty good one. My daughter, who's a type 1 diabetic, swears by it. sugar levels to energy levels to everything. She swears by it. Another good supplement, to be honest with you, for most people is grass-fed beef liver. It has a lot of
Yeah.
nutrients. We have the capsules in our office, but
Oh, I just swallow a little chunk of it raw every
yeah,
day.
yeah, I used to do that, but then I just got the capsules.
Oh, then sometimes you get those liver burps and it's like fish oil
I
burps.
know some people sear them in a little bit of milk. They soak them in a milk for an hour and then sear them. Makes it taste a little
Oh,
bit better. But yeah, I think that's one of that's one of God's most nutritious substances is beef liver, I think.
absolutely. Dr. Rogers, it's just so fun talking with you. I feel like I need to have you back. I've just enjoyed this conversation immensely. And I know we're getting to the pointy end of it, and we've covered a lot of topics today. But as we wrap up this podcast, I ask all my guests the same closing question, which is, what haven't I asked you that you'd like my listeners to know?
Well, in today's medical world, learn to be your own doctor. I told one of my patients yesterday, you know that saying, an apple a day keeps the doctor away? It does, but only if you throw it at him. So that's my statement of the day right there.
Those were your same closing remarks on our first podcast, was to be your own doctor, to be sovereign. And I love that idea.
Yeah. Look, start doing your own research. And if your doctor won't listen to you, find a new doctor who will listen to you. And if any of your listeners want to get on, we've had a live Q&A every Tuesday night from 7 to 8 for many years. So if anybody ever has any kind of medical question, Ben and I are answering questions live every Tuesday night from 7 to 8. It's on all the platforms, performancemedicine.net. So we get people from all over the world, and they're very knowledgeable people. They're people like you that are really interested in, outside the box things, common sense things. So
Which isn't so common.
it's uncommon, isn't it?
Oh, I've been
I
having
agree.
such a great time. I also wanted to remind people that that's Eastern time, 7 to 8
That's
Eastern.
Eastern time. That's exactly right.
And I know you mentioned it once, but can you please tell my listeners where they can go to learn more about you? And also, are you taking telehealth appointments?
Yeah, we do. We do telehealth. Nowadays, you almost have to. But yes, performancemedicine.net. That's our and you'll get into all our portals and all that and all our information on what we do. And my podcast. I mean, I've not missed a weekly podcast in 8 years. So you can look up my podcast on oxalates or rapamycin or really fungus on your toenail. I mean, there's so many. I have to come up with something new every week. So I put a lot of effort into it. So you can look at my archives and go through it.
I love that so much. And now you've really piqued my interest on rapamycin. So let's have you back for a third time. We'll cover rapamycin and see where the conversation goes.
Okay. All right. Sounds good. Thank you, Ashley.
All right. I really appreciate it. Thank you, Dr. Rogers. Thank you so much for listening today. I know your time is limited, and I truly value that you spent it with me. If you have the time, a review would genuinely mean the world to me. You could also do a quick shout out on Instagram. I'm at Ashley_Daily, or Welcome to Wellness Podcast. Your voice matters. And as I always say, you vote with your money. So if you're wanting to help support my work, visit ashleydaily.com. This podcast is presented for educational and exploratory purposes only. The published content is not intended to be used for diagnosing or treating any illnesses, disease, or disorders. Those responsible for this show disclaim any responsibility for any possible adverse effects from the use of this information presented by myself or my guests. Please consult with your healthcare provider before using any products or services referenced in this podcast. The content here is for informational purposes only. Episodes on the Welcome to Wellness podcast may at times cover sensitive topics, including, but not limited to, depression, suicide, 5G, nootropics, circumcisions, birth control, the Women's Health Initiative, the use of plant medicine, abortion, geoengineering, terrorism, gender, AI, and sex, drugs, and rock and roll. You are advised to refrain from listening to this podcast if you are likely to be offended or adversely impacted by any of these topics. However, if these topics interest you just may have found your tribe. The information or opinions expressed on the Welcome to Wellness show are solely the views of the individuals involved and by no means represent absolute facts. Opinions expressed by the host and the guest can change at any time. The views of my guests are solely their views, and the Welcome to Wellness show does not accept responsibility for them. Any action you take based on the information contained within this podcast is strictly at your own risk. The Welcome to Wellness host, Ashley Daly, will not be liable for any losses or damages in connection with the use of this podcast. You should take all necessary steps to ascertain the information you receive in this podcast is correct and has been verified. None of the guests or contributors on the Welcome to Wellness podcast will be responsible for your use of the information contained therein. Under no circumstances will the Welcome to Wellness show or my affiliates, partners, suppliers, licenses, or guests appearing on the show be liable for any direct or indirect consequences or damages arising from your ability or inability to access this podcast. All intellectual property rights belong to me, Ashley Daly, and include, but are not limited to, the copyright and any other rights in the design. You are permitted to use the Welcome to Wellness podcast for personal use, but not commercial use without license. You may not make recordings. If you breach these terms, you lose the right to access the Welcome to Wellness podcast, and you must destroy or return any copies of the recordings you've made. Guests on the Welcome to Wellness podcast may at times provide information or read extracts from third-party copyrighted work. The Welcome to Wellness podcast does not provide any medical or professional advice within these episodes. If you take any action or inaction as a result of the content you consume from the Welcome to Wellness podcast, this is based solely on your decision, and Ashley Daly, the Welcome to Wellness podcast host, and my guests cannot be held responsible or liable for any of the consequences of such action or inaction. Thank you.